And now, as we continue to follow this morning's job report, let's bring in Yahoo Finance's Anjalee Khemlani, who is monitoring job growth in the healthcare sector. Yes?
Yes, that is correct, Jared. And
What's
we've
going on?
seen actually a pretty positive news for the healthcare sector, which for the first time in several months, we've seen such positive growth. Overall, 57,000 jobs added in June. And this is, compared to the previous month in June, but it still is a concerning number because it's well below February 2020, which, as we know, is like the start of the pandemic. And that's when we actually saw a loss in the sector. And that was interesting because, of course, that was a time where the industry was really under stress. And we saw the need for more healthcare individuals in the industry. Now, it's important to point out that this resignation, this part of the great resignation that's been going on, has been attributed to worker burnout. And that is in large part due to the stress and the fatigue that these healthcare workers are feeling as a result of the pandemic. And the problem is actually looking out into the future, because what we have is growing population, aging population, chronic disease growth. And so all of that puts more pressure on the healthcare industry and the need for these workers to actually be there. So we're losing people at a time in an industry where there is actually more demand and more stress on these jobs. There have been issues underlying payment structure and the way that hospitals and health providers do pay for certain jobs. So it's really a mixed bag on sort of the conflating issues that are part of this. But it really speaks to, on one hand, yes, numbers are up. On the other hand, still a long way to go.
And let me ask you about how they're getting paid. I would think, and this is happening in the airline industry, pilots are getting raises, people are unionizing. Is there any kind of efforts to raise pay, to get people organized, to be able to pay doctors and nurses and hospital staff a larger salary, a bigger salary, so that we can get people, live bodies, qualified bodies in these places?
So two things that are happening. One, the tech side of healthcare is really where the demand is coming from. So a lot of people are moving into more flexible positions, things that are more tech enabled, and that's where a lot of interest is. On the flip side, you also have the payment structure, and this is really the key issue that underlies a lot of the job payment issues, and that is you have to think about where payment comes from. It's mostly insurers or the government, and actually in large part, most hospitals do rely largely on government to make up a good portion of their pay, especially the busier urban ones. And that's a problem because, as we know, government isn't necessarily a large reimburser, right? So all of that put together really puts a lot of pressure, and always has, on the provider side when it comes to being able to afford anymore. And that's where, the competition comes from with all these new tech jobs, tech-aligned jobs, or even what we saw during the pandemic, which was nurses were quitting at their hospitals, at their dedicated hospitals, and preferred to be traveling nurses instead because it paid better. And so we're seeing a lot more of that still happening.
Shifting job mix, and we got to get those numbers up somehow. It sounds like healthcare is ripe for disruption. Always great to have you here in studio on a Friday, Jobs Friday. Thanks for stopping by, Anj.